Hello everyone, this is Kalyana Kumar Shanmuga Priyan. So today we are going to do the cranial nerve examination. This is my patient. What's your name, sir? Hello. What's your age? 19. So we're ready for examination. We are going to do the 12 complete cranial nerve examination. For the physical examination, we will begin with the cranial nerve, one of the olfactory nerve which mediates the sense of the smell. We make sure the nasal passage is open by compressing one side of the nose and asking the patient to sniff to the other with the eyes closed, and bring mildly aromatic and familiar substance such as a perfume or coffee under the open nostril. If the patient detects a smell, ask him to identify it. The optic nerve mediates the vision to assess its function and check the patient visual activity and the visual field. Remove the glasses and inspect the opaque fundi of both the eyes. Make sure the ratio of the caliber of arteries to veins, usually 1 to the 3, and changes in the arteries like vascular narrowing. Also look for papilledema pallor from optic atrophy and any cup enlargement suggesting glaucoma. For checking the extraocular movements in the six cardinal directions of gaze and look for conjugate movements in any of the six directions which cause diplopia. Ask the patient which, if any direction, makes a diplopia worse. Inspect the eye closely for asymmetric deviation of movement. Determine the diplopia is monocular or binocular. Ask the patient to cover one eye and perform the cover uncover test. The test for the convergence of the eyes by asking the patient to look at your finger as you move it forward and bridge of his nose. Eyes can usually follow your finger within 5 to 8 centimeters. Identify any nystagmus and involuntary jerking of the eyes with quick and slow components. The sensory portion of the nerve mediates facial sensation and sensory part of the corneal reflex to palpate the temporal and masseter muscle. In turn, ask the patient to clench the teeth and note the strength of the muscle contraction, and then ask the patient to move the jaw from side to side. Now going to test the sensory portion of the trigeminal nerve. I will assess for the pain that it will be sharp on the patient. I told him to close the eyes and the test for the pain sensation using the sterile sharp end broken or with the cotton swab stick. I stimulate the patient's forehead and check the point indicated occasionally, and substitute the other end for the sharp one, and your test will be scattered areas and compare the symmetrical areas on both the sides of the face. For the next test, we need a cotton and tell the patient to look up, and when you approach the patient from the side out of his line of vision and lightly touch the cornea with the cotton. Normally eyes will blink. Inspect the patient face at the rest, and during any conversation note any asymmetry. Ask the patient to show his teeth. Tell the patient to close his eyes so tightly that you can't open that. Now wrinkle the forehead and puff out your cheeks. Now assess hearing with a whispered voice test. I told my patient 9 plus 1 and he said correctly. For this test, air and bone conduction using the Weber test. It is same in the both the ears. Laterization using the Rainy test. The patient should say ha or yawn as we observe the soft palpate in the pharynx. The soft palpate should rise promptly and symmetrically, and the vulva should remain in midline. Now going to test the gag reflex, which the consists of the elevation of the tongue and the soft palpate and the constriction of the pharyngeal muscles. Stimulate the back of the throat lightly on each side in turn and note the gag reflex. Many normally healthy people have a diminished gag reflex. The sternomastoid and the upper trapezius muscle from behind and tell the patient to shrug his shoulder upward against the hands. During this maneuver, evaluate the strength and contraction of the trapezius muscle. Now turn the patient chin into the hands and tell the patient to turn his head to each side against the hand and observe the contraction of the opposite sternomastoid muscle. Now check the words of the patient. Tell him to read a paragraph. I inspect the words. Inspect the patient lungs on the floor of his mouth and observe for a troponin. Some coarser restless movements are often seen in a normal